Please subscribe and watch this video until the end to know the complete information.
Hello, in this health sketch we want to talk to you about stroke. It's a bit of an odd name, stroke. It certainly has nothing to do with tennis strokes, swimming strokes, or brush strokes. The word stroke comes from the idea of receiving a strike or blow, as that is how quickly strokes appear. All of a sudden, people are struck by this illness. Did you know that every year more than 15 million people worldwide have a stroke? Of these, 5 million die and another 5 million are left disabled. Whilst most strokes occur in people over the age of 65, they can occur in much younger people too.
A stroke is very serious and needs to be treated right away. You'll commonly see this in elderly people, but you can see it in all ages, in all walks of life. You want to diagnose it quickly, and you want to get help quickly. So what is a stroke?
A stroke occurs when the blood flow in part of your brain is blocked. After just a few minutes, the starved brain cells begin to die. Normally, the brain receives blood via two major pairs of arteries, which branch throughout brain tissue and supply your brain cells with a constant flow of oxygen, glucose, and nutrients necessary for their functions. In one type of stroke, ischemic stroke, an artery in your brain narrows or becomes completely blocked, preventing normal blood flow. The blockage may be caused by a blood clot, also called a thrombus, which forms in an unhealthy artery of the brain. The lack of blood flow causes the tissue the artery supplies to become starved or ischemic. Similarly, the blockage may be due to an embolus, a blood clot that forms elsewhere in the body and travels to the brain. The embolus lodges in a narrowed artery and obstructs blood flow. In contrast, during a hemorrhagic stroke, abnormal bleeding disrupts normal blood flow. For example, in an intracerebral hemorrhagic stroke, a blood vessel bursts, spilling blood directly onto your brain, while robbing the intended tissue of nourishment. Both the hemorrhage and ischemia destroy brain tissue. A subarachnoid hemorrhagic stroke occurs when a weak spot in a blood vessel wall, called an aneurysm, bursts and leaks blood into the tight space between your brain and your skull. The high-pressure bleeding results in serious damage to brain tissue. Immediate treatment for your stroke may help to minimize brain cell injury and death. If you have an ischemic stroke, you may be given medication to break up the clot causing your stroke. Later, your doctor may recommend surgery, such as carotid endarterectomy, to reduce your risk of having another ischemic stroke. In the case of hemorrhagic stroke, emergency surgery may be necessary to repair damaged arteries or reduce the pressure of the blood on your brain. You may be given medication to help the brain's blood flow return to normal.
If your stroke causes difficulty swallowing, dietitians can recommend special diets or feeding tubes. If you have problems with communication, speech and language therapists can help. If it has become difficult to walk or perform daily tasks, physiotherapists and occupational therapists can offer exercises and home adaptations. Also, after a stroke, people often feel low or frustrated that they can't do the things they used to, and don't like being dependent on others. Counselors can help talk through these feelings, and many patient groups are available for further support. We've talked a lot about strokes, but what can we do to prevent them from happening? Even if you've already had a stroke in the past, there are many small steps we can all take to reduce our future risk of having a stroke, such as lowering high blood pressure, the number one cause of stroke, stopping smoking, lowering cholesterol, being more active, eating healthily, lowering alcohol intake to within recommended limits. If you have diabetes, keeping good control of blood sugar levels.
Stroke can manifest differently in different people and when different brain parts are affected, but one thing all patients report is that they start suddenly. I will now tell you the warning signs that can be noticed up to a month before it happens and can help you, your friends or family prevent a serious, life-threatening condition. Listen carefully and consult your doctor if you are in doubt. 1. Breathing difficulty. You should not be ignoring this major sign of stroke. 2. Unexpected pain. If your upper body pain is accompanied by feelings of weakness or an inability to move a specific side, seek medical attention. 3. Hiccups. Painful hiccups could mean a stroke is on its way. Most of us think of the hiccups as a mild annoyance that disappear just as quickly as they start. There are instances, however, when this irritating bodily function could signal a stroke. 4. Mood swings. 5. Trouble speaking. This symptom usually indicates that the area of the brain that controls language isn't getting the blood supply it needs. If you can't keep up with your friend's riveting story no matter how hard you concentrate, this is a definite sign of a stroke. 6. Unconsciousness. There is a situation where fainting is a sign of stroke, and that's if the part of the brain affected by the lack of blood flow is the area that helps keep you awake and aware. If you've fainted after a dizzy spell and you're feeling a little less coordinated than usual, it may signal something serious. 7. Lightheadedness or weakness.